Hi, welcome to Rajal Night. In today's video, we are going to discuss about the Medicaid eligibility. As we all know, as far as the healthcare itself is concerned, there are two different health insurance plans, government insurance plans we have, federal as well as state government sponsored. Two plans we have in healthcare. So one is about Medicare and second is about Medicaid. Medicare is a kind of plan which will be again divided into four different parts like A, B, C, D, plan A, plan B, plan C, plan D, all that. But whereas Medicaid is a kind of, and Medicare is a plan which is majorly sponsored and managed by the federal government, and at the same time, it is being managed and coordinated by CMS, Center for Medicare and Medicaid Services. In the same way, when it comes to Medicaid, Medicaid is a kind of program which is a joint federal and as well as state government program, majorly useful for the people whoever has having low income group people, right? So at the same time, disabled people, individuals with disabilities, right? So seniors and all that. So this Medicaid is a program which exclusively meant for low income group people. So that government, it is being jointly managed by the federal and as well as state government, of course. But as far as the rules and regulations, some considerations and all everything may vary from state to state. Depends on the demographic and geographical condition, all that. And this Medicaid will also be added with one more thing, which is called Children Health Insurance Program. This is also, which is called CHIP, CHIP, right? So this is also a part of it. Also part of Medicaid. So CHIP, right? So which we call it as CHIP stands for Children's Health Insurance Program, right? So this is also part of Medicaid, all that, right? So this is what it was. Now, majorly this Medicaid health coverage, majorly for, as I mentioned, this is for the citizens of US and as well as people whoever is having individual disabilities, right? So children, pregnant women, seniors, all these are comes under the healthcare and health coverage under the Medicaid part. But when we are trying to determine the eligibility, usually this eligibilities we do this Medicaid eligibilities and all everything will be based on 3 points. So eligibility is based on the following. The first one is called financial eligibility. Second is called non-financial eligibility. Whereas third one is called effective date of coverage, right? So these are the 3 things. So one is financial eligibility, second is non-financial eligibility, followed by effective date of coverage. Now, when we talk about financial eligibility, this financial eligibility will be based on MAGA, right? So let me write down here. So financial eligibility is based on MAGA, we call it as. So MAGA stands for Modified Adjusted Gross Income. Right? So this is what usually we call it as MAGA. Right? So based on this MAGA and all that, this financial eligibility will be determined. But when we talk about MAGA, this majorly used to determine the financial eligibility, as I told you, right? So for uh, Medicaid people, whoever comes under the Medicaid plans, whoever are related to that. At the same time, even CHIP, which is called Children Health Insurance Program. At the same time, whatever the premium tax credits, cost sharing reductions, availabilities through health insurance marketplaces, right? So all these things are comes under this. This is what generally the first point as far as the eligibility of Medicaid itself is concerned from the context of financial eligibility. Now, second is based on the non-financial eligibility. Non-financial eligibility is not the financial eligibility, but this eligibility will be given uh, to certain qualified non-citizens, means lawful permanent residents, right? So all these people are comes under this category, right? So these people may not be must be citizens of US, but in certain conditions, like in certain qualified conditions based on the government rules and regulations, certain qualified non-citizens like lawful permanent residents and all everything. So this is also one of the second thing, which is called non-financial eligibility, all that. The third was called as effective date of coverage. Effective date of coverage will be based on the date of application or the first day of the month of the application. So this is also one of the key prominent element will be taken. But here there is a point we need to understand as far as the stoppage of eligibility itself is concerned, because the stoppage of the eligibility will be done end of the month, provided, for example, a person has no longer meets the required eligibilities and all everything. So this program will be stopped. So these are the three major aspects will be considered and will be taking into consideration whenever we are talking about medical eligibility or the Medicaid eligibility. So in reference to the Medicaid eligibility, so these are the three important and key elements will be taken. One is about financial eligibility, as I told you, financial eligibility based on MAGA. Again, I'm repeating, right? Modified adjusted gross income. And second, non-financial eligibility is nothing to do with financials, but this is for the citizens of US, but sometimes depends on the certain qualified non-citizens. This can be even, they are also even eligible based on the government rules and regulations. At the same time, effective date of coverage, as I mentioned uh, now, but there is a parameter, but there may be a possibility that it may stop if the people has not understood all that, right? So these are the three basic eligibilities which normally we do. Normally, government do when we talk about Medicaid eligibility itself is concerned. So this is all about this video, and of course, this video is helpful for the people who are working as a business analyst in healthcare, or else people who are planning to work or planning to make a career as a healthcare business analyst, or else people who are applying for jobs, right? Aspirants, all that. At the same time, this is even, of course, not only for BA, people who wants to learn more about the healthcare, Medicare and all that, Medicaid, all that. This is going to be helpful. So this is all about this video. If you have any questions, if you have any queries in regard to that, followed by any training as well as coaching needs, please reach out to the contact details, which will be posted in below to this video. Thank you.